The Open Therapy Institute is addressing bias in mental health care. Go to our website, opentherapyinstitute.org. We have CE credit workshops about overlooked issues in the field. You can go to our workshop page and register now and become a member. And for those looking for a therapist, we match people with someone who's highly skilled and truly open. Just contact us through the contact page on the website or email us at info@opentherapyinstitute.org. Hi, I'm Leslie Elliott Boyce, and I'm speaking with Dr. Andrew Hartz of the Open Therapy Institute. And we were just having a chat about this big concept of how thinking about people in groups leads to aggression, really, and how social media and the broader sort of forms of communication, as well as this kind of conceptual group thinking that we see pushed in social justice academics, is maybe it causes some real glitches in people and some difficulty with empathy and with feeling there. And I'm struggling. Even when we just talked about this a moment ago, I was trying to tell you this thought that I was having, and it was really hard for me to get the whole thing articulated. So what I'm kind of hoping is that through a discussion, I can learn to articulate this a little bit better, and maybe we can think about this concept a little bit.
Well, you were saying about how, like, when we talk about men's issues, women might feel attacked. When we talk about women's issues, men might feel attacked. That there's this kind of sense that whenever we're talking about a group, there's this kind of like it's really very ripe to exacerbate conflict, and that there's something that's really hard about thinking about people in terms of groups without it going there. There's something where it's like, okay, well, that's your group, but what about my group? And it just it really lends itself to that. Part of it, I can definitely feel like I experience that the more we think about groups, it does seem like the more conflict that we get. It's also like one thing that is, I think, partly related is the the idea of identity that I think before identity politics felt like it like became the mainstream mode of politics. Um, I don't think if somebody asked me what I thought identity was,
Mhm.
I think I'd probably like struggle with thinking about, well, what is identity and who am I and what does that mean? And probably at root, I would have thought, well, I'm like some type of like life force that's inhabiting a body. And what is the true self? The true self is some kind of like mystical, philosophical being or a soul or something like that. I think that's where I would have gone with the question of, who am I? As like it's like to me, it sounds like it has a religious ring to it.
I can
Um,
remember that question being really
yeah,
vexing. I can remember that, like
yeah.
having to
But
write about yourself in a college class. And I'm like, I can tell you what I do, but I don't know how to tell you what I am.
what because it's unnameable. It's kind of
Mhm.
like what's looking out from your eyes at the world. It's some kind of like being that is, you know, we think of as a self. And it's not pin downable and it's always changing or it's like this. And what I see is there's been a flip where people really identify with their image. And so it's I'm not the being that's looking out. I'm the thing that's being seen. And so there's an almost like an objectification as opposed to a subjective definition
Yeah.
of the self. It's like objective. And the objective is like it's my image. And even beyond that, it's the crudest, most generic, superficial categories that can be linked
Hmm.
to my image. Um, what color is my skin? What is on my passport? It's the most impersonal, it's the most external objective aspects of yourself. And it says really nothing about internal. There's this like conflating that this is who you are
Mhm.
at root is the crudest, most superficial aspects of what you appear to others as. Um, so there's something really dehumanizing, I think, that happens both to yourself, but that you also do to others as like, you're this, and like, you kind of like lose your personhood.
Mhm.
Um,
That's really interesting. That framing is that's so profound because the self, and going back to what I said, it was vexing for me to try
yeah,
to identify. I can remember that. I don't remember what the circumstances were, but it were there. I do remember that there were times when you would have to write about who you are, like in I guess what, like a job prep kind of course, or maybe you're doing a bio or something like that. And you're trying to sum up, who am I? And so having those kinds of identity labels to turn to is a way to resolve that vexation of not knowing the self. Like, oh, okay, I am a white, cisgendered, heterosexual. I mean, you've got the labels religious or non-religious, able-bodied, whatever. And that is, I can see how that would be appealing in a way, because the not knowing the what I am thing, that mystery that's deeply seated
right.
in our position as whatever we are that looks out of our eyes, is there's a discomfort with that. We
Yeah.
have this brain that wants to problem solve, label, categorize. And at the very core, at the very center of all of that is a self that we can't really categorize, that we don't really understand. And so those labels are kind of a resolution of that dissonance, perhaps.
Yeah, I think there's definitely a broad move towards labels
Mhm. Mhm.
and external labels and categories, and to kind of be like, I know what I am, and it's this.
Mhm.
And but it's a total prison, and it's really dehumanizing to yourself and others, and you lose the idiosyncrasy. I was just reading something recently about by Jung, and he was writing about how in experimental psychology,
Mhm.
the studies are all about the average response. And you're looking at the trend between the average of groups. But in clinical psychology, you're always looking at the idiosyncratic person. Everyone is an exception.
Mhm.
Everyone deviates. So you're always dealing with the uniqueness of the individual. And I think there's something with the group identifications where they're like, yeah, the exceptions to the rules, whatever, you know.
Mhm.
And it's very erasing of
Yeah.
people's subjectivity and their being and their humanity. And it makes it easy to dehumanize people and to hate them. But it's interesting how attracted people are to wanting to erase their uniqueness and latch on to, I'm a member of this group, or I have this label or that
Mm.
label. There's a And I think it's exactly right, because it's like we're paradoxical and contradictory, and we change and we have conflicts and nuances, and it's like impossible to hold all of that in your head.
Hmm.
So it's hard to like let yourself be something that's like so amorphous. So you want to like say, no, I'm this. Um,
Hmm. Is that
but yeah.
is that about what is that about if you go deeper under it? Is it about the idiosyncrasy, and the discomfort with that and the mystery? Is it about loneliness and death and meaninglessness, fear of purposelessness? What is that about? Why do we seek comfort in those group
I
thoughts?
Yeah, it's interesting. Meaninglessness. I mean, I'm not sure that this is exactly a response to your question, but I also think that there's something that's kind of like, um I think that everyone has to have like I'm really interested in cringe. And I have an armchair theory that cringe is baked into the ego, that
Okay.
you can't have a self-image or a coherent sense of who you are without some paradox or cringe or something.
Hmm.
So it's like you're a rapper and your public persona is really like tough or something, but you love to bake. And like it's or you're a preacher and your persona is very like moral, but you like love like raunchy jokes or like it's like or whatever it is. Like there has to be there's always going to be something, and it's not necessarily like contradictions. Like I do think people have contradictions, but a cringe is like it's a trait that just doesn't quite fit with the others, where it's
Hmm.
like, oh, you like that?
Hmm.
Like what? Like, oh, there's always those odds and ends that don't line up. As like I see you as the type of person who should enjoy A, B, and C and D, and but you like this thing or you do this, and that like it's like throws you
Hmm.
off, and you're uncomfortable. I wonder the awkward cringe is like because it's a challenge to the kind of characters that we want to have represented. That like, oh, you're not the character that I need you to be for me to feel like to feel coherence.
Hmm.
Um, and so it throws that off, and with that, there's this like anxiety
Hmm.
of like, I'm uncomfortable with the fact that you aren't the character that I need you to be to feel like the world is coherent. And so I feel this anxiety about the kind of incredible complexity and contradictions of everyone that I know are in myself as much as they're in you.
Hmm.
So you get so you get cringe.
Interesting.
And like, so I think cringe is like really, and I think the growth of cringe is obviously accompanies the growth of social media, where people's representation of themselves and others is entirely in
Oh
these
yeah, it's
images of
curated.
it's this curated persona.
Yeah.
And then you're like, oh, they do something that's not like their persona.
Yeah.
That's cringe.
Hmm.
But it's like, but of course, we all do things that aren't like our persona because
Yeah.
that's like we aren't our persona. Um, so there's something where like the more identified we get with these images and these character types or whatever, the more cringe we get. And then we're like more anxious about having cringe because we can't tolerate that like cringe is totally baked into having a role or a self-image or whatever. And you get this as a therapist a lot because it's like your therapists are supposed to, like going to museums or something. And I do like going to museums. But it's like what are the things that your therapist isn't supposed to like,
Yeah.
or that this person isn't, um and there's that they I think that's when you get cringe. Or
Yeah.
it's the hypocrisies, the contradictions, the change can be cringe. Um but there's this locking in to this objectification that people have of themselves. This is a different line of thought than you started with about the hyper focus on groups, um, but I think it's interesting. Like we get into this locked, like we're imprisoning ourselves in this persona
Hmm.
to deal with this anxiety. You imprison yourself into this persona, and then you're and then now you have anxiety about deviating from that persona,
Hmm.
and you hate people that are in different categories, and you hate yourself probably for being like insufficiently in your own category or something. This is, by the way, just to say, this is very much in line with Lacan.
Okay.
He's a French postmodernist,
Hmm.
buyer beware, but he does have an interesting concept called the mirror phase, where he really talks about in infancy, uh, presumably, the infants have this moment of recognizing themselves in the mirror and they identify with the image. And that's really a root of a lot of pathology is saying, I'm not this like jumble of limbs with no center. I'm
Hmm.
actually
I'm
this image.
that. Yeah.
And that I'm that. That's
Yeah.
exactly the way to do it. And so then now you have an ego. The ego for Lacan is really baked into the self-image. And
Mm.
he has all the flaws of I mean, maybe more so than any other French postmodernist. He has the flaws of French postmodernism in terms of like anti-rational thinking and authoritarian kind of vibes. And I think there's lots that's really poisonous in Lacan's thought. But the idea that this self-image becomes a central problem,
Hmm.
I think is really
Mm.
accurate. And more now than ever. And you see it with diagnosis too. Patients latch on to, oh, I have this diagnosis. That's what I am. If they can name it and then identify with it, then it's like, but then they're trapped. It's a trap, you know.
That's so interesting. I love that idea, that statement about identity being a prison. I being
Yeah.
imprisoned in that role. I think that really rings true. It's interesting. I can remember some concept. I don't remember who put forward this idea, but there was this thing I read about when I was in undergrad taking psychology courses. It was this idea that to label people is to dehumanize them and depersonalize them. So instead of calling people patients, call them people who come to the doctor or whatever it might be.
Right,
You
right,
don't
right,
like,
right,
and
right.
I thought of that when you said
Right.
patient, but
Yeah.
and I remember work at the time I worked in a medical group. I worked for a medical group doing a bunch of administrative stuff, and there was this, and I'd love to at some point, this total side note, but the idea of bureaucratic sadism, I'm really interested in how that
Mm.
develops and where that comes from, because I really saw that there. And I saw this sort of casual dismissal of the people that came to this doctor's office by some of the staff. There was this really like, you develop an in-group, out-group, you develop an us versus them. And they're always there was this like desire, I don't know where it comes from. It's so interesting to slightly get in the way of the people that are calling for help and to treat them like they're annoying you. And you see this all the time in the medical field. It's just
Mm.
to use the phrase you used a little bit ago, it's baked in. And I thought at the time, maybe it would be good to stop. Maybe this would help that not develop if you called people who go to the doctor instead of patients, or the lady who
No,
called instead of the patient. But
I'm gonna disagree with
that's
that one,
fine.
but no, but
I don't, that's not exactly my whole
yeah,
point,
yeah,
but I
yeah.
remember when it started the first time I heard pregnant people, I actually thought, oh, that's really nice. They actually think women are people. That's great. Because I felt like it was
Mm.
like this welcome into humanhood for women.
Oh, that's so
And
interesting.
then later I realized it was a way to dismiss the feminine aspect of
Interesting.
the most
Right,
feminine thing a
right.
person can do. So anyway, it's just some random ideas about that
I
kind of personalization and labeling.
I think some of the like euphemism, there's like the euphemism treadmill,
Right.
and like people who come to the doctor's office, to me, here's my association to it, that people who would use that phrase, I would imagine, are people who are anxious that they're self-conscious about the fact that they look down on them.
Yeah.
And so they're using this phrase to try to cover it up, but it actually like kind of reveals their anxiety that they think it's actually a degrading thing to be a patient.
Yeah. Well,
Whereas,
I think you're right, and I hear that a lot
yeah,
in like the euphemism treadmill, like how people who experience houselessness is like
yeah,
where we're at,
yeah,
right?
yeah.
But I guess I don't mean to replace patient with that phrase. I rather mean to say Mrs. Smith or Mabel or Edward S.
Right,
Johnson instead
right,
of the
right, right.
patient. You just
The
use
patient.
call the person
Oh,
by
interesting.
their name, and that reminds you that you're actually dealing with a human being. You're not dealing with the patients. Is this
Was
kind of
this
like
Was this a clinic that was dealing with people with really severe mental illness?
No, this was it was a primary care clinic. So yes and no, it's
Okay.
kind of
Oh,
everybody.
okay.
And it was a clinic that had the the population was mostly geriatric and mostly dual, like Medicare, Medicaid, so poor.
Okay.
And so you're talking about people who have a lot of need and have a lot of anxiety because they have a lot of insecurity and instability in their life. You're talking about people who
Right,
are very
right.
poor and older, and your health is deteriorating because they're always at the doctor. And you could just see just this dismissal of their humanity. And but it wasn't the first time I've seen that. Been on the receiving end of that as a patient over
Uh-huh.
and over again. And any woman
Hmm.
who has a crappy birth story, and there are
Uh-huh.
so many. If you start talking to women about their birth in a hospital, you're going to hear some really horrible stories that people just
Right, right.
they don't want to talk about it because nobody wants to hear it. But if you ask them about it, you'll hear some tales about the sadism of the medical field. And
Wow.
so, I mean, that's a topic that, and
Yeah,
I
yeah,
don't know
yeah.
if that's related to this whole first thing. I think all of these are kind of snaking around each other and interrelated, but this idea of putting people in other, if you create an in group, and even if that's an in group of us behind the counter at the doctor's office, then there's them on the other side. And so this group level, I wonder what we're doing when we can mass communicate, when we can send out a tweet that goes to everyone, and we're start how do you conceptualize who you're talking to? You might be able to hold in your mind 10 or even 20 of the people that you know are on your Twitter followers. But
Right.
at some point, who are you communicating to? Do you create like a presupposed sort of amalgamated human that you think you're talking to when you do that? And I just wonder if our
Wait,
brains
wait.
can't process that
When you do what?
when you like mass communicate.
Hmm.
So all of this group level thinking really comes down to thinking about people in wide swaths rather than the individual, the idiosyncratic individual sitting in front of you.
Yeah.
I don't know that.
Well, there is something, I mean, that's something that is about that I do think therapy as a practice has that is unique even compared to religion most of the time.
Mhm.
It's like religion tends to be a group experience. This is a place where the idiosyncrasy of an individual is really highlighted.
Mhm.
And it's it, it's hard to think of like how many places is that happening in like a relationship? How many like institutions do we have
Mhm.
that are really, really doing that, where that's really front and center? Um, and when if therapy loses its focus on that, it's really losing one of its most valuable tools. And it's true. You if you think about people as groups, I do think it can lead to some kind of dehumanizing, whether it's hating them or idealizing them. You lose a lot. I was actually just thinking because I watched the first season of White Lotus.
I haven't seen it.
It was pretty good. I know, I don't know. But I watched the first season and it was like I think there was just one black character. There was like a friend character, and I think her racial background was a little ambiguous, at least as far as I saw. But there was like one clearly black woman character, and I ended up feeling like she's the only one that didn't really have a lot of depth to me
Mm.
because she didn't have flaws.
Mm.
She was just kind of like she was good at what she did. She was nice. All of her problems were kind of caused by the world. And it wasn't an overbearing woke character, although there
Mhm.
were those elements of her character, but it was like she wasn't interesting to me
Mhm.
because it's like I've heard this story before and it's kind of like the idealized black character whose
Mhm.
problems are caused by white people and who has no flaws. And it's like, it's a stereotype.
Yeah.
It's like there's just nothing against the actor, nothing against any of that. It was just like I don't really see, um, and I think we really struggle to have characters. Like I think especially with the DEI influence in movies or the social justice influence in movies, it's really dehumanizing. Everybody becomes a what's the figure like basically like a representation of their demographic group. And you
Right.
kind of see this in like it was like Power Rangers or where you'd get these like the group of the five, and it's like,
Yeah.
oh, each group is represented by
Yeah.
something, and that's their avatar of that group.
Right.
And so they all have to be a particular way to fulfill. It's like, it's an incredibly like, it's not, it's obviously it's boring and it gets cliche really fast. And it's like, but it's like, there's a lot of like stereotyping and bigotry and like dehumanization that goes into that kind of rigid scripting that I think is over the past decade, it characterized almost everything.
Well, what's really interesting when you're talking about psychology being this area where that's this one field of study or this one philosophical exploration that really focuses on that idiosyncrasy of the individual. And I think that maybe that's one of the things that feels off about a lot of the things that are going on in the mental health field for me is that there's this inherent conflict between, say, that fundamental human idiosyncrasy and this medical diagnostic model that comes in and says, oh, you're this kind and you're this kind and you're this kind, and this is how we label you, and this is how we. And I'm not saying that
Right.
there's not some validity and usefulness to that. Like I personally really I think that archetypes are a really fascinating way to think about human
Right.
behavior and how we fit into things. But this this categorical breakdown of this is what you are, and then we do a smart treatment plan and we get you to be this kind of whatever. And
It's
it sort of fights with that. And just as
yeah.
the social justice does, it's at odds with some of that psyche, that soul, that uniqueness.
I think there is like a definite trend in the field, and it's honestly it's driven more than anything else by a desire to be evidence-based. You
Hmm.
know, for to be
Yes.
evidence-based,
Yes.
you have to have discrete categories that then have specific interventions that are
Yeah.
get proven to give a particular outcome. The
Yeah.
more idiosyncratic you get, the harder it's going to be to have a clear evidence-based plan. Um, I I would think about, you know, I think it probably surprised people, but most of my colleagues that I know, I think are the same way. I think about DSM diagnoses very, very little when I treat patients.
Hmm.
I obviously want to do that in the intake and figure out what the diagnosis is, but it's much more important what my formulation is
Hmm.
about like what is actually causing them suffering. And that's usually doesn't squarely fit into this is depression. It's like there's a life issue that is central, or there's a psychological pattern that's central that's feeding the depression. So it's not unrelated to the diagnosis, but that's what the treatment ends up being focused around. And I would contrast that. And I think there are therapists who are very rigid into diagnoses, but I would contrast that with the way these diagnoses exist online, where people they're not just conceptual tools to kind of get a treatment started and get a sense of what's going on and have something to put in the have a label that you often need for like bureaucratic reasons.
Hmm.
It's
Hmm.
like it's like an identity is like this is this thing, and it's like these diagnoses were developed very pragmatically over time, like not through this like they're not this absolute truth. They change every
Yeah.
edition of the DSM. So it's
I
like,
think you're describing something that is gained through wisdom, and there is a difference. a different someone who has the capacity to sit with the nuance of that and the question of who am I without needing it to be resolved versus someone who's at a point where they really are stressed by that and need a resolution for that. Someone who's dealing with, like, going back to that this ties into the
Hmm.
how do I say who I am? Oh, well, here, there's
Right.
a list of categories. Why don't you plop yourself into these? Now you're a white cisgender, heterosexual, able-bodied, blah, blah, blah. So if
Right.
somebody is dealing with a lot of stress because of their own dysfunction that they're experiencing in their life, maybe relationship dysfunction or um, lack of efficacy or depression and all these kinds of things that are really swirling about in them in this confusing and stressful way, and you give that person a diagnosis, it feels like an answer for them and they can over identify with that versus you sitting on the other side of that as the psychologist, able to process that this is a way to describe one aspect of this human being's experience at this point in their life. It is not the totality of that human being. There's a
Right. Right.
wisdom
Right.
in that, and I think that utility of the diagnosis the from the vantage of either of those people is going to be very different. And I wonder, and I know we wanted to wrap about 5 minutes ago, but this is so interesting, and
Yeah.
it's gone all over the place and
Yeah.
taken
Yeah.
all
Yeah.
these little roads. But one of the things that you kind of touched on when you were talking about the desire to be evidence based, I'd love to have a conversation with you at some point about what I perceive as an identity crisis within the mental health field, within the whole study of psychology, that I think I think that there are a number of things happening that are contributing to kind of an implosion right now in mental health care in the industry.
Hmm.
And I don't know, you're tapping into it when you're talking about that evidence base, and we're kind of talking about it with that conflict of the person-centered sort of uh, idiosyncrasy
Well,
versus the mechanistic.
there's something like, I mean, and this is like, maybe this is, I'd love to hear your thoughts about what's happening there. My yeah, when Jung is writing about this, and like he really sees the individual at a contrast to these mass group identities
Mhm,
as like something that's like specifically modern. And if you look at the scientific method, where if you're going to do a study, you're studying the average of one group compared to the average of the other group.
mhm,
Um, and and then if you're thinking about like how a healthcare system needs to focus, where they're kind of like diagnoses need specific treatments and we reimburse for this but not this.
mhm,
And if you think about mass institutions,
mhm,
they really need these there's everything in the modern world seems to push towards this kind of more mechanistic, dehumanized group
mhm.
identifications and mass cluster identifications, and it has a really hard time with the unique and idiosyncratic and internal and hard to measure and all that stuff. So it's definitely a central issue
Mhm.
for our period of time. But
Definitely. Wow. So much to think about. Thank you very much for
thanks,
having this
Leslie. Of
conversation.
course, thanks.